It's almost like you get into this situation where as an athlete, like you have pain or something, my knee hurts, so you back off squatting, and then
Completely, maybe.
yeah, maybe none, yeah, you don't squat at all, and then like your knee kind of still hurts. So then like you try to start squatting again, but then it hurts more, and then that load you can use just starts to come down even more. So it's like you almost just like lose all ability to train, and then you basically look at it as like, well, my knees just hurt now, and you might just give up on it or
Like me.
try to, yeah, right, find something else.
Well, and you were an extreme example because you had
Extreme example, barely has knees.
Yeah, but that exact thing is, it's actually termed in systems science the drift into low performance. So it's actually a thing.
It's a thing.
It's a positive feedback loop in the wrong direction. So positive doesn't mean good or bad. Positive means it's a reinforcing loop. You do less, you become deconditioned, therefore you handle less. That load hurts. You do less. You become
Is there a
deconditioned.
name for it? The Henoch principle?
Well, we call it in clinical athlete the drift into rehab purgatory.
The drift.
So you're just staying on this downward decline.
Right, yeah.
And then to your point, the person starts to almost identify with their injury, and then it becomes
Yeah.
really hard.
As a name.
Yeah.
Yeah.
It's the knee.
Old
The
Gertrude
old
there.
back.
Yeah.
And so like I deal with this all the time with SoCal powerlifting. So we have those clients who you find you have like your competitive clients that they'll do anything to train around the injury, and we'll try to we'll adjust volume, load, tempo, a range of motion. Like there's so many variables to adjust to ensure that they can perform and maintain their fitness. But then you have the client who's like goes to the local physical therapist in the corner that says stop what you're doing immediately, or worse, they're ortho. Stop what you're doing immediately. If it's an ortho, they're like, I want to open that thing up and take a look. How can, for the coaches that are listening to this, how do you have that conversation? We're not doctors, you are, but how can they have that conversation with a client that just wants to stop immediately because the doctor just spooked them?
I think part of it is making it has to be a dialogue. So you can't, like the mistake I've made in the past is I hear this scenario of the doc and I get like, ooh, I start getting pumped. Oh no, and like this person, maybe they actually have a relationship with that other clinician, and I'm over here just, beating that idea down. And so now this person's confused and stuck in the middle, and that's a really good recipe for that person to just kind of wall up and not listen.
Yeah.
So I think the first thing is you've got to ask questions, and like the direction that you want this conversation to go, but they've almost kind of have to realize it themselves. So people are generally reasonable, but they have to be reminded of the same thing over and over. So forget injury for a second. Just think of athletes. Like every athlete, hard charging athlete even, they know they're not going to set PRs every day, every time they come to the gym.
Unless they're 16 years old.
Unless they're 16. Yeah, unless they're a newbie in something. And at some point, that's going to stop. And they know that intuitively. Like if you ask them, I'm like, do you think you're going to set a PR every day for the rest of your life? Like, of course not. Yeah. But what happens when they have a crappy day in the gym? Their life is over.
Yeah.
So it's the same thing. It's just manifested tenfold because now the turnaround is not as quick, but it's the same conversation. So I'll actually pull it back to performance and use that exact example to say now, okay, here's what I think is happening. We talk about this kind of cycle that they've been on, and it describes usually exactly what they've experienced. And I'm like, is that kind of what we have going on? And get them to kind of agree to what's been happening, and then make that connection to, okay, this isn't going to be an on-off thing. It's not going to happen overnight, especially with people who have been dealing with stuff for a while.
Yeah.
And so just like training, we have to regain positive momentum over time, and it's going to look very gradual. And it's like a little kid who grows 3 inches in 6 months. They don't feel that growth, but it's like a big change.
Right.
It's the same thing with rehab. So as the coach clinician, you have to be okay with reiterating those points over and over, like it's the first time you said it, because they're going to be like, oh yeah, okay, it makes perfect sense. I'm excited. Thank you. 2 weeks later, they have a little mini flare up, and then it's like, oh my God, okay, I don't know what to do. Like, what should we do? And it's like, no, this is the same thing. This is exactly what we talked about.
So it's not a straight line. It's very jagged.
It's very jagged. And training's like that too, though. We know that. It's just a little bit, in rehab, tends to be a little bit more volatile, slightly more unpredictable, maybe more jagged. But if you zoom out far enough, you do see the overall trend is in the right direction. And that's what you have to point them back to.
Right.
And if you've got some KPIs, key performance indicators, it can be very simple. Whatever lifts they're doing, hey, we're lifting, it's like RPE and load. So you lift the same weight at now at a lower RPE. or lifting a heavy weight at the same RPE can be the same with symptoms. Lifting the same weight and now your symptoms are down. That's cool. Lifting a heavier weight, but you're not getting worse. It's actually a sign of progress as well. So all these little things you can point back to, but I think the biggest thing is being okay with having the conversation over and over and over, and being patient with that. And then the person will start to almost answer their own questions over time. Like
do you find that there's like a sales component to what you have to do as far as like, because I know like the whole like drift idea, I talked to you about that years ago when we, and I remember that being such a like impactful thing, because then you start to realize like, oh, I get what the problem is fundamentally. You just stop doing this. It's not like don't squat and then do this exercise and that fixes your problem and now that problem is gone, and then start squatting. It's just adjust your training to start, accommodating to what you need. Do you feel like that sales process is like something that is a skill you have to pick up as a PT, or you suggest, or is it like more just like hopefully it works when you kind of, this is what you have to say?
No, you're selling all the time.
Yeah.
Like those conversations, you are selling. It's just not, you're not making it.
Yeah.
There's no
closing at the end, right?
You're selling trust.
Yeah.
And you're selling buy-in, and you're selling their commitment to actually be part of the plan.
How do you do that? Like, let's say someone comes in and they're, they're probably super frustrated because they're maybe like have been dealing with some problems, a knee that always hurts. Maybe they're at the point even where they've given it a name, or it's like it's a thing that's part of their personality. Like, how do you approach that? Like, is it just a one-off thing, or do you have a strategy? Or
definitely not one-off. That first conversation is usually just the start.
Yeah.
Sometimes there's light bulb moments. Like a lot of times there's light bulb moments. Like just kind of the same thing that we just discussed. They start to be like, okay. A lot of times it'll be like, okay, so I'm just maybe like doing too much over and over, doing too much too soon, or like we can just adjust the training. I'm like, yeah, like that's where we can start. Now it's not going to be it's simple and sound and in face value, but that process is going to be kind of iterative, and there's going to be some ups and downs. But I also actually find what sells the best has been to simplify things for people, and for people to understand that they don't have to try to fix everything all at once.
Right.
And I've found less luck with somebody comes in with one issue or two issues that they're dealing with. They walk out the door with 67 new problems because I found every little thing, measured every little joint angle, pushed on this. Oh, see, that's tender. I dig my elbow into their leg. Does that hurt? Oh, yep. See, you got a trigger point there. And
IT band syndrome.
Yeah, exactly. So we got to work on all these new things now, and they've got problems that they didn't even know they had, quote unquote problems. But if we can go the other way and say, okay, we've got a lot to work on here, but here's where we can start. We've got to start somewhere. Like that's the biggest thing here. And people feel, what seems to be the case is they feel relieved that it can be simple to get going.
Right.
They understand, they're happy with just having a plan, because they are relatively logical and rational when you say, we can't fix everything all at once. It's not going to be an overnight fix. Like they get those things, but you can't just leave it at that.
Right.
You say, here's where we're going to start, and are you cool with that? Here's our options. Here's what I recommend, and we'll go from there. And that's the first sell, is just organizing the thoughts around where we start.